Diabetic retinopathy occurs when there is long-standing diabetes that may or may not have been poorly controlled. Subsequently, it causes leakage from blood vessels that will subsequently lead to decreased vision if there is retinal swelling, can lead to proliferative diabetic retinopathy, where patients develop subsequent problems including hemorrhage or bleeding inside the eye and retinal detachments. There is a wide variety of how diabetic retinopathy can present, and therefore it is extremely important that any patient with the diagnosis of diabetes receive routine visits with their retina specialist or ophthalmologist to make sure that these diseases are not progressing. Diagnosis occurs both with imaging as well as with clinical examination. So when a patient comes in, they're dilated, they have clinical imaging performed such as optical coherence tomography and fluorescein angiography to image the retina. Between that and the clinical examination, the doctor will then evaluate all of these aspects and determine if a patient does require treatment or if they do not. The frequency of when a diabetic should have eye exams is all dependent on the type of pathology and how advanced it is within the retina. Oftentimes when they go to the retina specialist will do all diagnostic imaging as well as a complete eye exam, and then will determine what frequency the patient should be examined. If there is significant pathology, the patient may be examined quite frequently. If the patient needs treatment, this might be every 4 weeks. If a patient needs to be just monitored without any treatment, it could be every 3 months or every 6 months. There is no one-size-fits-all when it comes time to monitoring for diabetic retinopathy. We like to tailor our treatment and our management to each patient individually.